Greetings to lovely Romania. I will speak to you today on the topic of innovation and how best to incentivize it. Human progress has two essential components, innovation and diffusion. On the one hand, we need creation, invention, and discovery. On the other hand, we need such innovations to be learned, taken up, and used widely to good effect. Diffusion is morally important, as we ought not needlessly exclude any human beings from the knowledge, know-how, technology, and culture that humanity has acquired. Dissemination is important also for innovation itself. Only those who partake in human progress can build upon it. Innovation often requires large investments in time and resources. But it has tremendous benefits, not only to the innovator, but also and primarily to many, many other people. It drives progress, and therefore we really want it, even if the benefit to the innovator isn't very great. And that means we have reason to reward innovations and to reward their diffusion. In our world, innovations are rewarded with patents, patents that enable innovators to collect monopoly rents through markups or royalties or licensing fees for their desirable innovations. This regime was globalized by the 1995 TRIPS agreement, which requires all WTO members to issue 20-year product patents. Now, this system has several disadvantages. One very important disadvantage is that the system promotes innovations only insofar as they benefit potential buyers or users. That works well for some innovations, but many important innovations mostly benefit third parties, and buyers then have no strong reason to use and buy these innovations. So here are some examples. Vaccines, for example. It's good to be vaccinated because you protect your own health, but one very large benefit of vaccination is the benefit to others. And people, in deciding whether to get vaccinated or not, whether it's worth the high price, they will often not take these third-party benefits into account. Even more clearly with green technologies. When I buy an electric car, the benefit to me is relatively small. The air that I breathe is just a tiny little bit better. But that benefit is shared by many, many other people. Billions of people today and in the future will also benefit from my driving an electric car. And nobody pays me for that benefit. And so I am unlikely to take that benefit into account when deciding whether to buy a more expensive electric car or a cheaper gasoline-powered car. So monopoly rewards can also lead to extremely high prices, and these high prices then lead to underutilization. Few people will use the technology, and also to deadweight losses, to large gaps between the sales price and the cost of production, so that many mutually beneficial trades between those two levels do not come about. This danger is particularly acute in a world like ours, which is characterized by very high economic inequality. I show you this here on the diagram. So here we have an innovation that is patented, and so it's sold at a profit maximizing price. Imagine the commodity is sold at $40. Then what you get is, or $38, what you get is a certain number of potential buyers are buying it. Here, the red line is the demand curve, which is given by or highly influenced by the purchasing power that various people have. Rich people can afford to buy the product at even very high prices, but poor people cannot. So here, the earnings of the innovator are given in orange. In that field, you make a certain profit per unit, and how many units you sell depends on the price. Now, if you lower the price, you will indeed sell to more people, but in the end, you will make less profit because your profit margin is much lower. On the other hand, if you raise your price to $100, you will actually make more profit because even though you sell to fewer people, you sell at a much higher profit margin and therefore, in the end, earn more money. So this is the reason why in a world in which the demand curve is very steep, it's often the case that products that are under monopoly, under patents, sell at these extremely high prices. Such exorbitant prices are particularly common in the pharmaceutical sector. I just give you one single example. A new hepatitis C drug, sofosbuvir, came onto the market a few years ago. It was introduced in the United States at $84,000 per course of treatment, which was 84 pills. So they charged $1,000 per pill. And that is roughly 3,000 times the manufacturing cost. These enormously high prices, of course, lead to extremely large deadweight losses, as many mutually beneficial sales don't come about. Sales between those two levels, the cost and the price. Exorbitant prices in general impede uptake. At high prices, fewer people are going to buy the product. And this is very sad in the case, for example, of green technologies. Green technologies would diffuse much better, would have many more customers, many more buyers, especially in the global south, if they were not marked up so heavily. And in this time, when we are desperately trying to reduce greenhouse gas emissions, it is pretty stupid to mark up our green technologies or to charge high licensing fees or royalties for their use. These exorbitant prices also have the disadvantage of excluding the poor. Many poor people who would want to buy a certain product cannot afford to buy it. Clearly, that's true with regard to sofosbuvir. Many poor people have hepatitis and they just can't afford the remedy. Generic manufacturers would gladly supply advanced medicines to these poor people at much, much lower prices. There are wonderful manufacturers in India and other places who can mass produce these products at very cheap prices, but they're not allowed to do so because there is a patent and the patent is getting enforced by all the governments. Millions of people, literally millions of people die every year in our world because they cannot get access to medicines that we have, but that are unaffordable to them because of their high patent-protected price. Poor people suffer an additional harm. Because they cannot pay high monopoly markups, innovators tend to ignore the needs and interests specific to these poor people. For example, they ignore diseases of poverty such as tuberculosis, hepatitis, malaria, measles, HIV/AIDS, tropical diseases, and so on. Even if you find a really good remedy for these diseases, you cannot sell a lot of your remedy to poor people at high prices. So it's just much better to work on cancer or heart disease or something like that, where you have rich people willing to pay high prices for medicines. Now, given all these problems, is there a way that we can do better? What we are proposing is that one adds impact funds to the mix as additional innovation incentives. Impact funds would be publicly funded and would invite innovators to forego, for a particular innovation and in a particular region, to forego their conventional monopoly privileges in exchange for rewards based on social benefit. In this sense, impact funds are a meta-innovation, an innovation in how we reward and incentivize innovations. They could be created in various domains of innovation, for example, in the pharmaceutical sector, in agriculture, in the green technology sector, or in education. An impact fund invites innovators to register any of their innovations for participation in a fixed number of consecutive annual disbursements, each of which is split among registrants according to impact achieved in the preceding year. So you have an impact fund, for example, in pharmaceuticals. 20 pharmaceuticals are registered. At the end of each year, you would measure the health impact achieved with these 20 products, and you would divide the pool according to the impact achieved. So if one particular product has achieved 8% of the impact, it gets 8% of the annual disbursement. Of course, to get this reward, innovators would have to make their innovation available without markup at the cost of production. Now, participating countries that would finance the impact fund, they would benefit in many ways. They would benefit through faster progress. Innovation would proceed at a faster pace. They would benefit through cheaper access to patentable products. So people, for example, would pay less for green technologies or less for participating pharmaceuticals or less for health insurance because medicines are cheaper. There would be much greater productivity because these innovations would be widely used, and there would be fantastic efficiency gains also because in the participating countries, you wouldn't have to patent your product. You could avoid all the cost and expense of patenting, the cost and expense of monitoring whether your patent is being respected. You don't need any patent enforcement, for example. You avoid all the deadweight losses of which I spoke before. You avoid the promotion efforts where companies that have competing products, for example, competing statins in the pharmaceutical realm, they make so much money on their product, so much profit, that they spend enormous amounts of money on advertising, but that advertising really just neutralizes or cancels out the advertising of the competitor. Finally, you have corrupt marketing practices because the profit margins are so high. And you have, for the same reason, a lot of counterfeiting. Counterfeiters are trying to produce fake copies of the real thing because the real thing sells at such enormous prices. You have increased third-party benefits because the impact funds are rewarding for these third-party benefits. So when we measure health gain, for example, we measure not only the gain to the person who takes the medicine, but also the gain to third parties. And the same with green technologies and so on. And finally, all these factors would increase tax revenues. The economy would be flourishing, and that would lead to higher tax revenues, which in turn would help states pay for the expense of the impact fund. Now let's go through some of the features and virtues of impact funds. Impact funds are optional for both innovators and funders. Nobody needs to participate, and there are complementary alternatives. Innovators can choose whether with any particular product, whether to register for impact rewards or not. And similarly, countries can choose whether to finance a particular impact fund or not. And this dual optionality makes it easier to establish impact funds in a gradual way. There's delinkage. While monopoly patents reward innovations through the sales price, and thereby severely impede their diffusion, impact funds cap the sales price at or near the lowest feasible cost of manufacture and distribution, and thereby delink the sales price from the cost of innovation. The cost of innovation is not included in the sales price. Impact funds then cover this cost of innovation plus appropriate profits through those reward payments that are based on the innovation's performance, of which diffusion is an integral part. Obviously, the more my innovation is used, the more impact it achieves. Here we have an objective measure of value, something like health impact or green impact, reduction of greenhouse gases, and so on. And that impact is measured in a way that is sensitive to externalities, but insensitive to the user's economic position and willingness to pay. So health gains for a poor person are counted as much as health gains for a rich person. Participating states contribute to impact funds in proportion to their gross national income, and that means that rich people pay more of the fixed cost of innovation. Rich countries pay more because they have higher GNI, and rich persons in those countries pay more so long as they pay, of course, higher taxes. Now, monopoly markups, the system is the same. It's the rich people who pay the fixed cost of innovation. In the patent case, they pay it by being the early users. Only wealthy, affluent people or well-insured people can afford to buy a drug during the first 20 years of the market. And so they really pay through the markup for the high cost of innovation. But there is one very big important difference. That is that with impact funds, we do not need to exclude poor people. With patents, they cannot get access for the first 20 years. But with impact rewards, they can buy the product right away from day one because the product is not marked up. It is sold at the cost of production. Now, impact funds create an artificial market, a wide competition across a whole domain of innovation. For example, the green technology domain or the pharmaceuticals domain, and thereby they sustain a broad quest for the most cost-effective progress. Let's see how we can innovate in a way that has the most impact, because that way we get the highest possible reward. When the reward payments are distributed in proportion to impact, that means that all impact is paid equally. For every unit of impact, you get the same reward. How much reward do you get? Well, that depends on demand and supply. When innovators find an impact fund's reward rate unattractive, then there will be fewer registration forward-going, and the reward rates will rise. Conversely, when innovators find an impact fund's reward rate generous, then registrations will increase, people will want to register, and the reward rate will go down. So the reward rate will equilibrate to a reasonable level through this automatic self-adjustment, and that assures innovators and contributors that this rate will be reasonably stable over time and will be fair between them, the innovators and the funders. Now, the attitude towards diffusion would change dramatically with impact funds. While patent rewards turn innovators into jealous spies in search of possible infringers, impact rewards encourage innovators actively to promote wide and effective deployment of their innovation with an eye to optimizing its overall impact. Please use my innovation. You can have it for free, and I will help you install it. I will help you make the best possible use of it, because the better use of it you make, the more money I get for the impact that my innovation has. While monopoly rewards tempt innovators in many ways to put profits over people, to withhold medicines from poor people, for example, impact rewards can align profits with human needs, thereby making the business of innovation much more equitable in terms of research priorities and access to its fruits. So we don't need companies to become miraculously moral. We simply give them the incentives that impact funds provide, and their profit motive will make them serve the interests of the poor and the interests of the many automatically. Innovators will do well by doing good. Now, as I said, impact funds are a meta-innovation in how we incentivize and reward innovations. And as such, they can work in any domain where we have a uniform metric of social value. The most important and straightforward sectors in which such impact funds can work are the pharmaceutical sector, the green technology sector, and then there are agriculture and education as well. Where do things stand now? Well, we have a book-length proposal for a permanent health impact fund in the pharmaceutical sector, along with a proposal for a 3-year pilot to be conducted in Africa at a cost of about 100 million euros. Here is our website, and you should also know that we are working on a green impact fund for technology that would implement an impact fund in the green technology sector. Thank you very much for your attention.